The next set of medications we are going to look at are class 3 antiarrhythmic medications. And class 3 medications are potassium channel blockers. Potassium channel blockers. These medications include amiodarone, Sotalol, ibutylide, right? And you can add tofetilide, but ibutylide and tofetilide are really similar medications. These are potassium channel blockers. So if I drew the myocardial action potential graph, where do you think these medications are going to function? What part of this graph do you think these medications are going to work on? Is it on phase 4, phase 0, phase 1, phase 2, phase 3, or back to phase 4? Where do you think class 3 antiarrhythmic medications are going to work? I hope you are shouting phase 3, phase 3, phase 3. Because if they are potassium channel blockers, then obviously they're going to work wherever potassium works. Maybe some of you are thinking, how about phase 1? Yes, they could also have effect on phase 1. But the biggest or significant effect we are looking at is their effect on phase 3. If they block potassium channels on phase 3, there will be a slower movement or slower efflux of potassium channels. There will be slower efflux of potassium channels. I hope you remember that. If you have slower efflux, you would have slower repolarization. So instead of having this very quick or sharp dip in action potential, what we are going to have is a slower progression, something of this nature, showing that the potassium channels are inhibited. So there's slower movement of potassium, meaning that the myocardial cell is going to come slower to resting potential. What do we call this phase? This is the repolarization phase. So there will be prolonged. The first effect of these medications you want to know is that there's prolonged phase 3 repolarization. Prolonged phase 3 repolarization. If phase 3 repolarization is prolonged, automatically it takes longer time for this action potential to be executed. So we know automatically that class 3 antiarrhythmic medications are going to increase action potential duration. What else is going to happen? The effective refractory period, this length of time, the effective refractory period is also prolonged. One other activity of phase 1 and phase 3 medications that you have to know, or class 3 medications that you have to know, is that they increase QT interval. And if you remember anything about your class 1 drugs that we saw before, it's that when they increase QT interval, they also increase risk for what? Torsades de pointes. They increase risk of torsades de pointes. That is important. These medications are used for 3 major purposes that you have to remember. One is for atrial fibrillation. The second is for atrial flutter. And the third is for ventricular tachycardia. Ventricular tachycardia. Now, for ventricular tachycardia, you may want to remember that it's primarily amiodarone and Sotalol that have this activity. Primarily amiodarone and Sotalol that have ability to manage ventricular tachycardia. The other important part of these medications for your exam is really their side effects. These medications have extensive side effects that a lot of questions could be asked from this area. The first medication we are going to consider is amiodarone. What you notice about this class of medication is that they are all completely different type of drugs performing class 3 effects. Amiodarone, when you look at the name amiodarone, in this name, you would see iode, this IOD right here. What that tells you is that there is an iodine molecule. That should remind you that amiodarone contains this iodine particle that could become problematic in the patient, actually. There are a number of side effects attributable to amiodarone. One of them is pulmonary fibrosis. Pulmonary fibrosis. If this medication is able to cause pulmonary fibrosis, then you're probably going to do pulmonary function tests, right? The second is hepatotoxicity. If it's able to cause hepatotoxicity, you may want to do liver function tests. The third is thyrotoxicity. I mean, if the medication contains iodine, you can naturally think that iodine, thyroid gland, is there a relationship? Quite makes sense, right? And again, we have to look at thyroid function test in these patients. Amiodarone also tends to cause some neurological and gastrointestinal side effects, but those are probably not the biggest things to worry about. Do you remember other medications that cause pulmonary fibrosis? Other medications that would cause pulmonary fibrosis. Are you thinking of bleomycin? These are important medications on your exam. Are you thinking of busulfan? Are you thinking of methotrexate? These are all medications that will cause pulmonary fibrosis. And then there's one special medication you may need to just hear. It's not big on the USMLE at all. It's metisagide. Metisagide actually causes retroperitoneal, so not pulmonary fibrosis, but retroperitoneal fibrosis. You want to remember these medications for that. Let's see, I can't draw a rectangle. All right, so bleomycin, busulfan, methotrexate will cause pulmonary fibrosis. Metisagide will cause retroperitoneal fibrosis. You want to bear these in mind. Amiodarone will cause hepatotoxicity. For that, we want to do liver function tests. It's going to cause thyrotoxicity. And for that, we want to do thyroid function test. The other thing amiodarone could do is make patients look like this. This right here. Amiodarone could produce this kind of appearance. This kind of appearance. Hyperpigmentation of the skin and this bluish grayish discoloration. This kind of appearance is described as smurf skin. It's called smurf skin. It's blue, gray skin deposits and discoloration, right? They're also going to have photodermatitis. They're also going to have photodermatitis. This is classic amiodarone effect. You want to remember that. It will also result in some corneal deposits. So it's basically depositing in the skin, depositing in the cornea, probably depositing in the thyroid gland, and literally all over the body. We have other effects of these medications like CVS, cardiovascular depression. Amiodarone will cause bradycardia. You remember the medication we said you used to treat bradycardia. I hope you said atropine. All right, it would cause heart block. I mean, if it can slow the heart, it can slow it enough that it's almost completely stopped. And then ultimately, it can cause heart failure. So these are no medications that we just give to patients and then walk away without looking back. The other medication you want to consider is Sotalol, because these two tend to have the biggest side effects, right? So you want to actually remember amiodarone and Sotalol, especially in this class. Sotalol, alol. Does that sound like a beta blocker to you? Exactly. Meaning that while you're giving a patient Sotalol, because you want Sotalol to act as a class 3 antiarrhythmic medication, it could actually still be exerting some beta blocking effects. And those beta blocking effects would become a side effect. So Sotalol has strong beta blocking effect, right? Strong beta blocking effect. Another thing you want to know is that these medications cause torsades, the point, but we have more torsades with, I think with Sotalol. We have torsades, the points, more with Sotalol and ebutylide, right? More with Sotalol and ebutylide. Amiodarone does not cause torsades, the points, like the other medications do, right? Like the other medications do. So you want to remember these about these medications. And those are class 3 antiarrhythmics. Next, we are going to talk about class 4 antiarrhythmic medications.